Okay, so thank you for being here. So this is a webinar, an hour or a little bit more about homeopathy for coughs. And I wanted to start with whooping cough because I've had it, and so and it was a surprise for me. And I've also noticed that there is a national outbreak in the UK. Apparently, there is a national outbreak in other countries like Germany. So it seems to be a theme. And I've also seen a lot of my patients call in because of really stubborn coughs. And I suspect that it might be whooping cough in their case as well. So first of all, what is whooping cough? My understanding was that whooping cough is a child, one of those childhood illnesses. And by the way, we are supposed to be all vaccinated, I suppose, for whooping cough because the vaccine has been around since the 1950s. So I assume I was vaccinated too. Certainly my kids were. But looking, going on the NHS website here in the UK, the National Health Service in the UK, the CDC page for the US, it seems that it seems to be, they describe it as a cyclical illness. And so regardless of vaccination, it seems to reappear every 3 to 5 years. Apparently, the last outbreak was in 2016. I never noticed. I don't know if anybody did, but that was the last one that was recorded. And also, they also do say that the vaccine does lose potency, and it only covers about 60%. And it probably decreases, the efficacy decreases as you get older. That said, obviously, I'm not a medical doctor. I know what the doctor here, my doctor, told me. So the symptoms of whooping cough, it starts like any regular cough or flu. It can start with a sore throat, then scratchy throat, a little bit of a cough. It is a bacterial upper respiratory infection. Okay, and so for that reason, it can be treated with antibiotics. The reason why it's called whooping cough, I mean, the technical term, the medical term is pertussis, is that there is this typical whooping or sighing sound, which, if you haven't heard it, it's probably difficult to describe. And I suspect because so many people are already vaccinated and it is not common for doctors to see cases of whooping cough, they cannot recognize it either. Hi, Tina. And so when I went to see my doctor and I asked if it could be whooping cough, she dismissed it and she said no, because it has a really, really distinct sound when you cough. It's like really like whoop, like a sighing thing. And I wasn't really coughing, and so she did not really believe that I had it. So the only way to diagnose whooping cough is with a blood test. And not every doctor is prepared or to do a blood test, even here. So since December over here, I was hearing all these people with a really, really long-lasting coughs, really stubborn coughs, to the point where doctors here were actually calling it the 100 days cough, which is a new thing to me. But I'm pretty sure that if they had tested more people, they probably would have discovered more cases. And I don't understand why they're not testing more people. So they tested me because in my case, I asked specifically, and I asked because talking to my chiropractor, she said, well, it sounds like you've got whooping cough. And I trust her judgment. She's very, very experienced. And that's the only reason why I asked. Otherwise, it wouldn't have crossed my mind, to be honest. And because I insisted, they tested me. They took the blood test and then they said, yeah, you do have whooping cough. So what does conventional medicine do for whooping cough? Now, if you catch it early in the first 3 weeks, the answer is antibiotics. There are specific antibiotics for whooping cough, not the general broad spectrum antibiotics. And that can work pretty well. If you pass the 3-week threshold, after 3 weeks, the bacteria, the whooping cough bacteria, are actually dead. And so for that reason, antibiotics will make absolutely no difference. You are not contagious anymore anyway. So conventional medicine doesn't really have much else to offer apart from perhaps steroids. Steroids are anti-inflammatory, and the purpose of the steroid is to reduce the swelling in the nasal passages, in the throat, in the mucous membranes, so that it's easier to breathe and the mucus comes out more easily. As we all know, steroids obviously come with side effects. On this occasion, because I'd never tried steroids before, and sometimes I treat myself as a guinea pig as well. So when the GP said, why don't you take this nasal steroid spray? It's very, very light. You won't, your body will not store the steroids. You'll be fine. It will just, keep your sinus clear. And but it's going to take 2 weeks before you hear, you feel the benefits. So you have to, scoosh every day, spray it in your nose. And I tried it once, and I had an allergic reaction. So my lips started to swell up. I was tingling in my lips, and it was very uncomfortable. And so that was the end of that. The good news is that whooping cough most of the time does not, it's an upper respiratory infection. And so unless you get complications, it will not go into the lungs. The only problem is that one of the characteristic symptoms of whooping cough is that it's much worse at night. That's because basically what happens is that your sinuses produces too much mucus. The mucus is very, very thick, very stubborn. It goes down into your throat, so you get a postnasal drip. And of course, what happens with that is that it gets worse if you're lying down, because you get this choking sensation, hence the whooping sound, because you literally wake up in the middle of the night going like that, trying to breathe. So what I found is that homeopathy helped me for the first 3 weeks to shift some of the symptoms. I wish I had an inkling of that it was whooping cough, because there is actually a nosode called pertussin. And again, if you take that early, because that happened with some of my patients when I realized that it might be whooping cough, pertussin can work really, really well, because it's the nosode for whooping cough. However, 2-3 weeks down the line, that will not help as well. So what did I do first? The remedies that I used at first, because there was an awful lot of expectoration and it felt like a typical kind of chest infection, was Hepasolve. Hepasolf is the antibiotic of homeopathy, especially indicated if your phlegm is colored. So whenever you are expectorating or spitting out phlegm that has a different color than clear, clear is the color that is supposed to be a healthy phlegm. If it's white, it's already not very healthy. When you see that it's yellow or green, that means there is definitely an infection. And Hepasolf really helped with that. And the other remedy that I was taking throughout was Ipecac, because of course this kind of thickness of mucus, etc., really makes you gag a lot. Sometimes it makes you outright vomit. And Ipecac helped me through the night, basically. Oh, please spell which one? Sorry, Bettina.
The last.
Oh, Ipecac, yes. Okay. Ipecac. Ipecac for cough with gagging. Okay. And Ipecac also helps to thin the mucus as well. So that has been very, very helpful. Okay. But like I said, after 3 weeks, the prognosis for conventional medicine is that you can help yourself maybe with nebulizers, with humidifiers, you know, inhaling, aromatherapy, but there is really nothing much else that you can do. Homeopathically, I found that surprisingly, Calcarea carbonica actually helped just to absorb the excess of phlegm. But I also look at other things that may not be strictly homeopathic, but they're natural. And so things like salted water, seawater. The best thing that I found actually is this. This is a seawater spray, nasal spray, and there's nothing else but pure 100% natural seawater, and it works fantastic. It helps with, you know, killing bacteria, thin the mucus in the throat. It's a great help. So other than that, I am glad that I used homeopathy, because the prognosis is that even though the bacteria, like I said, the bacteria for whooping cough dies after 3 weeks, but the damage done to the respiratory, to the trachea, to the throat, means that you can have the symptoms for another 2 or 3 months. And so it is a very, very tough illness, I would say, to treat even homeopathically. However, I've had this for 4 weeks now, and I'm actually much better. So I am not going to have this, touch wood, for 2 or 3 months. So that's why I wanted to do this webinar, because I saw that obviously I'm not the only one. By the way, it's very, very contagious, but I'm the only one in my house to have it. But bear in mind that it is contagious. But for if you catch it early, I think the trick is really to catch it early, to identify it early. And if you do, pertussin, for sure, is the remedy that I would, I'll actually put it in the chat. Okay, that's the nosode. But definitely consider Hepasolf, Ipecac, antimonium tart if you feel that the mucus is rattling in the chest, but it's not coming out. But I would say that those are the ones that really, right. Does it help to use botulinum or tuberculinum? I was thinking about tuberculinum, but because it doesn't really reach the lungs, at least not in my case, I always think that the first thing when you feel like your chest is affected or it is really coming from the lungs, the first thing I think about is bryonia.
Yeah.
If you have a tightness in the chest, Arsenicum album. Sometimes you can have a burning in the chest, and so causticum, phosphorus can also be useful. But that's when you're going down, and phosphorus is a tubercular remedy. So before tuberculinum, I mean, it has to be really, really bad to use tuberculinum, in my opinion, anyway. So the idea is that you also don't want to you don't want the illness and the symptoms to get deeper and further and hit your lungs. Hopefully, it has to stay on the upper respiratory. So that's really the story with whooping cough. And I wanted to compare and contrast with another type of cough that is also very, very common, which is croup. And this is more for children. I haven't seen that in adults, but croup is much more common, much more widespread. And croup is not a bacterial infection, it's a viral infection. And for that reason, there's no antibiotics used from, by conventional medicine. It's more towards steroids, again, to reduce the swelling in the mucous membranes. And again, particularly when we're talking about children, if we can avoid using steroids, it's a good thing. Eustacia helps with stagnant cough. Yes, I heard that at the beginning of COVID. Actually, the Indian government, the Ministry of Ayush, mentioned that remedy. I've never actually used it. I don't know how easy it is. It's a very small remedy. But yeah, I actually remember writing a blog about it and just reporting what the Ministry of Ayush recommended. Has anybody ever used Eustacia?
Yes.
How was it? How did you find it? Okay. Yeah, okay. I have never used that. I found with COVID that the usual remedies that I would use for flu and coughs worked pretty well. So I didn't stray from the common remedies that I knew, but definitely it is worth looking into them. But again, we're talking about lung when it gets into your lungs. And whooping cough, really, it's all in the throat. It's your sinuses. It's like it's almost like my doctor. That's why my doctor didn't believe that I had whooping cough until I tested positive, because it really looks like a common sinus infection. It's your sinuses working overtime, producing too much mucus, and the mucus goes back into your throat and creating, you know, postnasal drip, and that's it. So, yeah. But croup is, like I say, it's a viral infection. It's a different thing. The quality of coughing is different. It's a barking. It's a really dry barking, sudden type of cough. And for that, I find that most of the time, again, the trick is to catch it early enough. And so things like aconite, remedies like aconite, definitely help, particularly if one of the modalities is that you really want fresh air, you want a breeze, you want to open the window, even if it's in the middle of the night, you feel like you need fresh air. And so aconite, and also because it has this element of suddenness, because the child can be sleeping and suddenly it starts with this barking cough, and it's very sudden, it's very scary. So all right, okay, so they're advertising okay, beautiful. Yeah, okay. Well, actually, I have to say no, here, not yet. In fact, I feel like they're downplaying it because they're calling it the 100 days cough. They're trying to downplay it. I wanted my husband to be tested as well, just as a precaution, but the doctor didn't want to do that. They said, no, that's okay, just take your antibiotics and you're fine. So they don't seem to be interested. That's what I'm thinking, which I find a bit strange, because even just for, you know, if you know, because on the one hand, they are saying that there is an outbreak, but at the same time, they're not interested in collecting data, at least, to see how many people. So I don't really know. It's kind of, you know, mixed messages. But of course, if you go on the NHS website, they keep telling you, yes, of course, do, you know, take your injections and stuff, but they're not pushing anything right now. So I'm grateful. So that's fine. For croup, really, there is no vaccine and there is nothing that you can do. You have to follow the symptoms. And that's the thing, going kind of wider in general, treating coughs homeopathically, I find it really challenging. I know that a lot of homeopaths find it challenging. I don't know, Yifat, what you think? I mean, even experienced homeopaths find it challenging. One of the reasons is that the symptoms are shifting constantly. And so you are chasing the symptoms, you're trying to keep up with the symptoms, and it's not always easy. It's not always easy to determine, particularly if you're treating a child, whether, you know, where do you feel the cough? Is it in the chest? Is it in the throat? Is it better if you lie down? Is it better if you do this, if you do that? So there are lots and lots and lots of different remedies, and there are lots and lots of different modalities and kind of nuances. So I try to stick to the tried and tested remedies. I put together a kind of cough kit with 18 remedies that are the most used. But of course, there are way more than 18. But I try to identify the ones that are really, really useful. So dry coughs, for example, I find Drosera very, very useful for dry cough. I've actually taken that at the beginning as well, in this past 4 weeks, because the cough was coming like in attacks. So I was not coughing constantly. I was coughing very, very rarely. But when I started, I couldn't stop for about a minute. And so it was really, really like a coughing fit. And that coughing fit would make me really, really tired, which is another symptom of Drosera. And it would start with a really annoying tickling in the throat. So I would be lying down, I would be fine, trying to sleep, And then this really tickle in the throat, it was unbearable. I had to cough, and then it wouldn't stop. And it was very, very, very exhausting. So Drosera was pretty good at calming down for this symptom. And it's worse at night. Spongia is as well, is a very good remedy for cough, for dry cough, particularly if during the day. And there is this extreme dryness of all the air passages. So the nasal passages, the nose is really dry, the mouth is really dry, and it's a kind of barking cough. So that can also be a remedy that you can think of for croup. It's very important to understand, for example, whether the modalities, they're really important. So, and one of the most important modalities are the hot or cold. So typically, for example, for whooping cough, definitely cold is way better. Drinking cold drinks. I was literally chewing ice. It gives relief. It's probably because it helps with the swelling. If your throat, if your nasal, if your sinuses is inflamed, it probably helps with that, and that's why I felt much better. So that's an important modality to have. Arsenicum, for example, you can exclude that in cases of whooping cough, because arsenicum is chilly and arsenicum wants warm drinks, for example. Arsenicum is a fabulous remedy if you have a kind of asthmatic cough, and if you feel that kind of heaviness and tightness in the chest, the shortness of breath, wheezing. So, for example, arsenicum, I use arsenicum a lot during COVID, at the beginning especially, and particularly because there is always a psychological element to these things. And during COVID, the fear, obviously, was everywhere, because, of course, you know, it was a pandemic, so everybody was scared of catching it. Everybody was scared of going places, meeting people, and in the people around me, I noticed I started giving out arsenicum album like Tic Tacs just to shut people up, because when I could see that friends, you know, family started to get really anxious, even without the symptoms, but they started to say, oh my gosh, what if I catch it? Oh, oh, what's going to happen? That's the first thing. And when you think about it, when you're scared, you don't breathe properly. Your breathing is more shallow, and your breath is shorter because you're going like that. So you're making yourself ill almost. So it's a kind of catch-22. So if you have that physical symptom, yes, then that's scary. That makes you scared. But if you start with the fear, then you have the physical symptoms. So that's why I think arsenicum is really, really good to begin with. Another remedy that I really, really love is stannum. Stannum metallicum, I think it's underrated. It's a great remedy for asthma in general. And the difference between arsenicum and stannum is that arsenicum makes you restless. I mean, not arsenicum makes you restless. You're restless. If you need arsenicum album, you are anxious and it makes you restless. The anxiety makes you restless. You cannot relax. Stannum is tired. So you have the shallow breathing, the difficult breathing, the shortness of breath, the wheezing, and it makes you really weak. You feel very, very weak. So stannum is quite distinctive and easy to identify. When we come to productive cough, I like antimonium tart a lot when you feel that there's something in the chest that wants to come out and it's not coming out. And that's really, really good, and it works really, really quickly. It's very effective for that. And then once it starts to come out, then you can see what's coming out. And it's important to see what color it is, the consistency. Is it thick? Is it thin? Is it ropey? Is it stringy? There are lots and lots of different variation. So you can have a nut-muir kind of phlegm when it's kind of frothy and sometimes even salty. And it can be clear or white. And the symptom of nut-muir is that when you cough, it makes you cry, makes your eyes water, or it can give you a headache as well as shortness of breath. When you see that your phlegm is yellow, you can think about Calisolve. Calisolve is thick, it's yellow, it's rattling in the chest. It's difficult to spit out, to expectorate, because it is very thick and it makes you wheeze. So there is that in the chest. If the phlegm is greenish color, then you can think about pulsatilla. If the modality is that you need open air, you feel better in the open air, you open the window, or if you go outside, you feel better. If you if there is like an infection, if you feel that there is, it's gone deeper, it's a deeper infection, then phosphorus or Hepasolve. Hepasolve, definitely, if you think it's a chest infection. And it's a greenish color, frothy. There might even be some specks of blood mixed in. Or the phlegm might look kind of purulent or have a bad smell. And there is also the chest tightness, the oppression of the chest, the burning sensation. If you have a burning sensation, causticum or sulfur, think along this line. Phosphorus definitely likes cold, feels better with cold drinks. Phosphorus is as well chewing ice. So you can check the modalities. Heat and cold are really important. Sensitivity to heat or cold are very important to point to the right remedy. And then spasmodic cough, which is part of, you might describe the whooping cough also as a kind of spasmodic cough, but there's other types of spasmodic coughs that are not necessarily whooping cough. So Sambucus, which is worse during the night. It's suffocating. The sensation is suffocation. And you wake up because of coughing spells. And there is a whistling sound from the chest. So it's very similar. It can be very similar to whooping cough. So Sambucus can also be helpful in these cases. But also, surprisingly for me, Senna is also a very good remedy for spasmodic cough. Senna maritima with a violent cough, and particularly if it makes you vomit, because it's so violent and so strong that you end up vomiting. And it's really intense. So you have these coughing fits. Coccus cacti is the same, except that Coccus cacti is worse in the morning rather than the night. And again, it can end up with vomiting mucus. When the symptoms, when infection goes down into the lungs, like I said, bryonia is my first port of call. It's a hard cough. It can be blood streaked as well. There can be chest pain during coughing, like stitching pain in the chest. But this is my very first one. And I find that, again, if you catch it early, bryonia is usually good enough. And then the really annoying postnasal drip. Postnasal drip, like I said, is when your sinuses is producing too much mucus and it goes down your throat. So you may be breathing perfectly well through the nose. There is no congestion. There is no the typical sinuses pain like under the eyes. There is none of that, but because the mucus goes straight down your throat, and that's the postnasal drip. So Corallum rubrum is very, very good. It's a good remedy for cough, for coughing fits that end up in postnasal drip, i.e. you are swallowing the mucus instead of spitting it out. And it also makes you very, very tired. This kind of symptom makes you very tired, and that's also how you recognize coral remedy. So these are the remedies in a nutshell that I use. I know that there's more. There's definitely more remedies in homeopathy. I tried to narrow down because it's just too much. There's too many, and I tried to narrow down the ones that are most useful according to the type of cough. For now, for example, once you have done for whooping cough, once you've done your Hepasul, so there is no more infection, and the cough is not annoying anymore, it's not that frequent anymore. My recommendation really is to just keep going with saline spray, nasal spray, and I'm not taking any remedies at the moment because I don't feel that I need anything anymore. But I wish I had taken the pertussin at the beginning, to be honest, but okay, but I didn't know. Okay. Any questions so far? Sorry, Tina. Okay, I think it was corallium. Coral.
Oh.
It's red coral. Corallium rubrum, which is another remedy that is very small and it's not very much used, but it's very, very useful for, the cough that comes in fits, that when you start, you can't stop. And it's like a kind of machine gun kind of cough. Okay. So any questions so far, or have you had experience? Yes, propolis diffuser. Yes, diffusers are really good. I haven't tried them yet, mainly because I'm lazy and I couldn't be bothered getting one. But eucalyptus, if you can inhale, with aromatherapy, eucalyptus is really, really good. Or a diffuser, a humidifier in the room with aromatherapy, eucalyptus, propolis. These ones are very, very useful. Sleeping with your head, raised helps. So for example, I thought of lachesis because obviously it's worse lying down and it makes you choke, but lachesis had no effect, and so I did not include lachesis in the list of useful remedies this time. Any question? Right, the dosage. Okay, so first I would start with the potency, and so if you are at the beginning, I would start with a 30C And when it comes to acute, this is what I do, and every homeopath is different, obviously, but when it comes to acute conditions, I usually put remedies in water, and I dose every 15 minutes or even 10 minutes until you feel better. I am not averse to mixing remedies either in acute situations, just to speed up the process. I do that during flu situations. I did that for COVID, and it works really well. But every homeopath is different. I don't know. Yifat, do you have any suggestion, or have you seen cases of whooping cough where you are?
Well, I'm not sure if it's whooping cough, but there are a lot of cases of of coughs. Not only here, also in Israel, when I have a few
Oh, right.
clients as well. There was last month, there was like few cases, one after the other. And it was like an outbreak. It was defined as an outbreak of whooping cough.
Right. Mm-hmm.
But here, it wasn't tested or anything, so I don't know if it was whooping cough or not.
Right.
It
Okay.
was, just like a regular cough.
Yes, I've definitely seen quite a lot in the US, but I had no idea. I noticed that it was the same here because I know people around here. I know people who've had a cough since December. They're still coughing. They're fine, but they had to take 2 or 3 rounds of antibiotics and steroids and this and that, and they're still not 100%. And so I thought, okay, it must be something really stubborn going on. I thought it was maybe a different strain of whatever it is. But yeah. Mm. Yes, there are different. Yeah, there are some theories, and I read some things on the UK government side. They try to explain away this, but they also say that with whooping cough, it's kind of normal, like every few years to have an outbreak, but they cannot really explain it very well. We can only conjecture, but again, it's they should really collect some more data and see. Definitely with my patients, it took a while to find the right remedy, and in some cases, and then it depends also on what kind of underlying issues, because there are patients who already have underlying issues. And so, for example, I found Paragen worked really well in patients with underlying issues. They had already susceptibility, they already had previous condition or chronic conditions going on. So Hepasolve helped, but then they took Pyrogen because nothing else was helping. And so I thought, well, what about Pyrogen? And amazingly, it helped. I didn't expect it to help so quickly, but Pyrogen is something that I'm using a lot at the moment. I don't know if it's don't know. It's one of those waves. So Pyrogen is a remedy for deep-seated infection, like sepsis. But I thought it was just for sepsis. But I noticed that really stubborn infection of any nature, it can be a chest infection, or it can be any infection that is chronic, that has become chronic. And so if you have something like that going on already, and then on top of that, you have this really stubborn cough, that's when you have to think more outside the box. So, right. So streptils. I have been using this, but I am not having success with this. In fact, I have patients who were on the streptils and they still got the cough, and it didn't help. And so I don't know what to think about that.
Well, you know, Paragen contain streptococcus and staphylococcus in it.
Right.
So,
Yeah.
yeah,
Have you
maybe,
been using the strap teal, Yifat?
yeah.
So it's a different, so it's a strap remedy, but it's been triturated. It's a C5 trituration instead of a C3. So it's been triturated more, let's say. And so it acts at a deeper level. And it's very, very promising, but I've been using it a lot. And I have to say, to be honest, it's very patchy. Very patchy in terms of success. Dr. Tilch is the homeopath who came up with this remedy, and there is an interview that I did with him on my channel, and I can actually very quickly send you the link if you're interested, just to see what it is. And it's really, really interesting, but it's not as effective as I was hoping, unfortunately. And so, for example, for strep infection and things like that, it can help, but for other things, no. Hang on, I'm going to send you the link here. Ding, ding, ding. Okay, there it is. Yeah, thank you, Tina. Yeah. Okay. Any other questions or any experience?
Yeah.
Okay. Okay, I think that's everything. Yeah, that's all I have. You can get it twice. Well, yeah, I think you can get it twice because the effectiveness, what I read is that the effectiveness of the vaccine goes down. I mean, at its best, it has a 75% effectiveness. And then as you get older, it goes down. And so maybe that's why I honestly cannot remember whether I had it or not as a child. I seem to remember inhalers and things when I was a kid, but it's very, very vague. So maybe I did. I had everything else, so I might have had that too, but you can definitely get it twice. It could be that, for example, my kids, because it's part of the vaccine, is part of the DTaP vaccine. So my kids obviously had it, and maybe because they're still young, it's still effective because they haven't caught it from me. So I don't know. But you can definitely get it twice from what they're saying. That's why they're asking people to vaccinate again. But I mean, how many?
They ask everybody.
Yeah, exactly. I mean, well, like a pincushion. So yeah. Okay. So yeah, I hope it's been useful. It is really, really hard to treat. Whichever way you want to treat it, it's a bit of a pain. But I think the trick really is to catch it early. So just have more awareness that it's out there at the moment.
And how long do you recommend like trying stuff and it's not working? So you've evaluated, I'm going to try pulsatilla, and how long do you give the doses? Like for 24 hours and then it doesn't do anything, you switch, or you have advice
No,
about that?
even shorter than that. For acute situation, if the remedy is the right one, you see the difference immediately. Immediately. So, or close to immediately. So like Ipecac, I took it, I was really choking. In the middle of the night, I took that, fine, I could sleep for the rest of the night. So that really, really helps and it works. If it doesn't work, it doesn't do anything within an hour, I'm like, no, it's not working. So.
Okay.
Okay. Right. Okay, so I think that's it. I think I'm going to take the
Thank you.
stop the recording.